Thank you, Mr. Chairman. I'm a physician and actually have trained or worked in a variety of these entities which have provided for the uninsured. Did my residency and fellowship at Los Angeles County, and for the last 20 years have worked in the Louisiana public hospital system, specifically working for the uninsured. Among other things, set up clinics for the working uninsured who couldn't afford health insurance but were too rich for Medicaid. So if I may say, my life's work has actually been how do we address this particular issue. In fact, that's mainly why I ran for Congress, is, man, I care so much about this. I applaud the motivations and I applaud the goals of the folks who drafted this legislation. If lowering cost, improving quality, and expanding access is the goals, I share those. My concern, my fear, my intuition, my 20 years of service have brought me to the conclusion, though, that this bill will not accomplish those shared goals. It won't fix what's broken in our health care system because it offers nothing innovative. We've said the rationale for this is that we've got to control cost. Medicaid is bankrupting states. Medicare is going bankrupt in 2018. Medical costs account for over 50% of all personal bankruptcies in the United States. Skyrocketing health costs are affecting small businesses, and yet this plan is going to double down on the Medicaid, Medicare paradigm that is contributing to that all. This bill won't lower costs. It doesn't have real innovation. Not in health care delivery. I'm a doctor. I'll look at it. It doesn't have it. No real plan to lower costs except to assign payments without regard to what the cost is. Health care is broken because it is payer-centric. It's not patient-centric. Again, government already controls 50% of health care spending. Doubling down on what's broken is not the solution. In a very real way, this bill just replaces the private insurance bureaucracy with a government bureaucracy. The only innovation is nationalization of health insurance and maybe politicalization. I was telling my staff, right now we get all these calls for people concerned about their interaction with Medicare, the Veterans Administration, the Army Corps of Engineers, finding these bureaucracies so difficult to work with that they come to our office. I said, let's get ready to hire a couple more staffers because now we're going to give them a whole nother reason to call. It's going to be the government-run health insurance plan. And part of that, inevitably, is because we're rushing this through for an artificial political deadline. Tom Daschle said the Clintons lost because folks went home over the August recess, got an earful from their constituents, didn't like how the plan was going, came back, decided not to vote. Now, clearly that's the rationale, quite openly stated, for getting it through by August the 1st. I would just ask that instead of rushing through a plan that will embarrass members over the August recess, we engage, someone said both parties, I agree with that, and come up with legislation that we can be proud of. Not try and sneak it through in the dead of night. Let's hope no one notices when we finally get it out. No, something that we will be glad to talk about in our town hall meetings. The American people deserve better. They deserve to be able to participate. Again, I applaud the motives and the goals of this legislation. As a physician who for 20 years has worked in the trenches trying to bring health care to the uninsured, I hope we achieve our goals. But I only ask that instead of rushing this through, again in the dead of night, so to speak, we seriously invite all parties, we come to the table, we come up with something that will truly be sustainable, that will truly address costs, and ultimately, above all, be patient-centric, not bureaucratic or payer-centric. I yield back.